Period pain happens when the womb contracts to shed its lining and causes a woman to bleed. This process is triggered by chemicals which are called prostaglandins. Prostaglandins are released from the womb, or what we call the uterus, during a period, and so it stimulates the womb to contract. Now, when the womb is contracting, the blood vessels inside are being squished, and because blood carries oxygen, that means that during these contractions, there is less oxygen being delivered to the muscle of the womb, and this is what causes ultimately that crampy pain that we feel. The name for painful periods in medical terms is dysmenorrhea, and there are two types, primary and secondary. Some cramping can often be very normal, especially in the first few days of your period, and this is what we call primary dysmenorrhea. However, if your pain is so bad it's stopping you from working, exercising, socializing, or just getting through the day, it's not something you should just ignore. There may be an underlying condition like endometriosis, fibroids, adenomyosis, factors which are contributing to the pain that you experience, and you may need further treatment or even input from a specialist. This is what we call secondary dysmenorrhea, i.e. there is a secondary cause impacting the severity of the period pain. Ultimately, if you're experiencing really painful periods, it's really important to speak to your GP. There are ways we can try and relieve the pain without medication. If you are looking for relief without medication, there are a few things that can help. So gentle heat, such as heat patches, can really help, or gentle movement and mobilization like yoga, stretching, or walking. It is very common to have period pain every month, but it is not normal to be in severe pain every month. If your period is interfering with your work, social life, sleep, it's so important that you speak to a doctor about this. You don't need to wait until it becomes unbearable. If it's affecting your quality of life, it's definitely worth getting it checked. If the pain is severe, getting worse, or affecting your daily life, please don't leave it and see your GP. Period pain like this should always be investigated and taken seriously. We can discuss it, whether there is suspicion of an underlying cause, organise some basic further investigations such as blood tests or even an ultrasound of the womb, and talk about treatment options which are right for you. And even if your period pain is not due to a secondary cause, there are lots of medications that your GP can prescribe to you. It's really important to note that if you ever experience severe pelvic pain and have a fever, feel very unwell, or have irregular discharge, this can be suspicious for pelvic infection and must be seen urgently on the day. So again, it depends on the cause of the pain and what suits your lifestyle and your personal medical history. Options can include different types of pain relief medication, hormonal treatments such as contraception, which can include oral pills, or the coil containing the hormone progesterone, depending on what is suitable for you. Sometimes you will need specialist review by a gynecologist to investigate if anything further is going on. The key is finding a treatment plan which works for you, and that is something we can do together. Today, we've been talking about painful periods, but I want to mention similarly, if you're experiencing excessively heavy periods, this is also important to ask your GP about. So ultimately, if your periods are causing you so much pain that it's interfering with your everyday life, please speak to your GP about it.